So my presentation at the European Academy of Neurology conference was the results of a survey we did in European Alzheimer's disease consortium centers. The aim of the survey, which was an online survey, was to try to get an idea of the clinical practice of physicians diagnosing patients with mild cognitive impairment with regards to diagnostic disclosure, biomarker counseling, and follow-up. And we invited all member centers of this consortium to participate, and we had 41 centers out of 69 that were willing to participate, and out of those 41, we had 35 that replied. And we asked each center to identify at least 5 physicians that saw patients with mild cognitive impairment on a regular basis and who were willing to answer our survey questions. And we ended up with a bit more than 100 replies. And we really asked a variety of questions. And what we found was that in most centers, biomarkers were used, and that physicians in general found that biomarkers were helpful with regards to diagnosing and prognosing patients, with some variability across the biomarkers, so that those biomarkers associated specifically with AD pathology, so that is amyloid and tau, were seen as those that were had the highest value with regards to at least prognosis. We also found that there was quite a large degree of heterogeneity with regards to how patients were counseled prior to biomarker sampling. Some did rather extensive biomarker counseling, whereas others did not. We also found quite a lot of heterogeneity with regards to how physicians counsel patients following biomarker sampling. So with regards to whether physicians discussed the underlying cause, risk of progression, and rate of progression. With regards to follow-up, in general, patients or physicians reported discussing preventive measures that patients might undertake, but only in a minority the physicians reported discussing advanced directives and driving and so forth. And that was perhaps a bit surprising, in that patients with mild cognitive impairment are more likely to be able to independently consider what their future should be like. And that might be one of the advantages of an early diagnosis. Of course, physicians might also be reluctant to discuss these matters because they are uncomfortable, both for the patient, but maybe also for the physician to discuss. We also found some heterogeneity, but not as much with regards to follow-up and how often and how long patients were followed. But in general, these patients were followed for quite long. At least that's what the physicians reported. So in conclusion, we found quite a lot of heterogeneity with regards to biomarker counseling, and also other aspects of diagnostic disclosure in patients with MCI. And we really feel that there's a need for guidance for physicians on how to do biomarker counseling, how to follow up patients with MCI, how to disclose a diagnosis of MCI.